Timely access to healthcare is one reason why a lot of morbidity and loss of lives happens across the country. A recent study in the Lancet said that it's predominantly those who are from the lower caste communities who have decreased access to healthcare and have increased risk of various both acute infections and chronic infections and death due to that. So that is our target community, serving those who are the most underserved. Good Shepherd has centers in 19 states across the country. Currently, Good Shepherd has 4 clinics, has about 30 health centers, and 1 small hospital across the country. Good Shepherd Health has been working for over a decade, serving underserved communities across India through the fields of community health, clinics, and public health teaching, providing people access to equal, affordable, and quality healthcare, with the main purpose of helping people reclaim human dignity through healthcare. Good Shepherd Health every year has a direct impact of over 400,000 patients, impacting about 1 million lives every year. We have about 150 health workers across the country. A community health worker is the tier 1 of Good Shepherd's health program, and she is not only a health worker in terms of providing basic health care, which is learning to recognize illnesses, treating common ailments, and referring them at the right time, but also providing health education within the community. The health worker is also a person who gets to know about a family's economic situation as she builds trust in the community, and so she's able to identify when a family is going through a hard situation. So Good Shepherd Health, in its experience within the community, realized that the vulnerable community it served were not only vulnerable to health inequalities and the consequences of poor health and decreased access to healthcare, but were also at risk of various social injustices, particularly human trafficking. The main problem in these underserved communities is the lack of economic viability, lack of sustainable livelihood opportunities, and healthcare is strongly linked to that. So lack of poor healthcare would increase a person's economic imbalance in their family and make them more at risk to sell their children, their wives into the whole human trafficking, organized crime. Identifying girls at risk, stopping trafficking from happening, intervening at the right time, and providing opportunities that protect the girl from further exploitation is very key, and that's what Good Shepherd has been doing in the last 10 years, and giving them education, giving them health care, giving them scholarships to livelihood programs. Thank you, dear partners, for being part of our journey in providing good health care to the vulnerable across the country. Please take a moment to reflect and realize that the achievement that Good Shepherd has been because of your involvement and partnership with us. Each one of you have been part of our journey in helping us deliver healthcare to those who are most vulnerable and most neglected. And so we are so grateful for this partnership and look forward to a continued partnership in the future. Thank you.